one of this is one of the webinars in our Chorus webinar series, and we wanted to have a webinar really looking at the wider determinants of health and thinking about multi-sectoral responses in light of these wider determinants. And as you all know, this is one of our pillars in Chorus, our second pillar, all around addressing the wider determinants through building collaborations across sectors and trying to strengthen the multi-sectoral interventions that we have in our cities. I think it's one that is maybe a bit out of our comfort zone. A lot of us are coming from public health backgrounds, from really focusing on the healthcare system. And suddenly we're realizing how much we need to work with other sectors and how important that is to the health of people in cities, particularly and disproportionately poorer people in cities. So we've really realized that in Chorus, and we want to try and sort of move our focus to be able to have some projects, particularly as we look at our project twos in Chorus, which will be the second line of projects that we all work on, that some of those might have more of a focus on multi-sectoral responses. So we thought it would be very opportune to take advantage of one of our Chorus advisory group members, Prof. Charles Hongoro. And Charles will be doing a 20-minute presentation about the kind of wider determinants and some of these issues. Charles is a health economist by training and a sort of long and distinguished career in health policy making within health systems in South Africa, but across the continent. And then we have Dr. Jemma Phillips, who works at the University of Leeds in civil engineering and has worked on water and sanitation. And she'll be talking us through some work that they've done in her department. But before we go on to the presentations, I just want to give a bit of background to some of these ideas, and particularly how they might be relevant to our work in Chorus. So let me just share my screen. Can you see the presentation? And is it in presentation mode?
Yes.
Yes. Is that a yes? Good. So, apologies for the wrong date. This is a rescheduled webinar. I hadn't quite changed that. So this was something I wanted to highlight. I was looking for studies that had identified the kind of attributes to mortality and morbidity. And the only one I managed to find was looking at the US. And so this is their example. And I just wanted to highlight to you here. So what they've done is they've taken different factors to work out the how much they're attributed to mortality and morbidity. And I think what's really interesting here is you can see they've looked at health behaviors, and these are often the things that in public health we focus on, individuals' behaviors, whether it's tobacco use or diet, and you can see that is linked to 30% of mortality and morbidity is due to health behaviors. And then they've looked at clinical care, and 20% of the mortality and morbidity is related to the clinical care that people get. And again, if you think about how our health resources work, I think you can realize how much our focus is very much skewed on clinical care, and that actually when you look at it, 50% of the sort of causes, the attributes of mortality and morbidity are actually social and economic factors and the physical environment. Now, this was a study that was done in the US, pulling together different information about risk factors and looking at the attributable risk. And that's obviously in a setting with social protection, with good water and sanitation. So what these proportions would look like in low and middle income countries could be very different. And actually the impact of social and economic factors and physical environment on mortality and morbidity may be much, much higher. So I thought that's really interesting. If anybody has a study, a similar study that's been done in a low and middle income context, I'd be really interested to see that. I think that could be really useful. Something which I think framework which we may well find really useful, the Commission on Social Determinants of Health. And I just wanted to flag this really as if you are thinking about these issues, particularly for your project twos, it's worth reading the report of the Commission on Social Determinants of Health. They pulled together this framework from multiple frameworks, but it really emphasizes the kind of wider context and the wider determinants, right from governance and politics, public policies, social norms and cultural norms, as well as all these sort of gender and intersectional issues that are so important within Chorus. And then these issues around individual risk behaviours and the healthcare system, all impacting on health equity. So a really valuable framework for thinking through our projects. And I know that we've tried to use this framework in some of the qualitative analysis from the project ones as well. I wanted to share this reference. It may be something you're interested in following up on. They apply these ideas particularly to the urban setting, and they really highlight the importance of urban planning and design. And like within this, they include anything around housing, traffic, air pollution, green space, and then the kind of social conditions and work conditions of people living within cities, and increasingly environmental change and the impact that has, and that all of these things sort of come together to have this impact on urban health equity. So again, another really useful framework if you're thinking about these issues. And then I wanted to highlight the health in all policies, which I know that some of you are really aware of. And it's a great initiative by WHO to really encourage other sectors to think about the implications of their actions on health and to think what they could do to actually improve health. So taking as an example, I mean, there are loads of resources, by the way, on that. If you click that link onto the WHO website, and loads of examples of trying to do health in all policies across different sectors. But just to kind of try and make clear what it actually means. So if you take the example of air pollution, 1 in 8 deaths is linked to air pollution, and mostly that's from heart disease, lung disease and stroke. So if you were taking to address this issue, if you were using a health in all policies approach, what would it look like? So in terms of the energy sector, this would be really looking at the household level, looking at emissions within the household, how you try and reduce those emissions. So it could be things around cooking practices within the house and use of wood stove, fossil fuel stoves, and thinking about emissions and energy use. Within transport, it would be about working with the transport sector to consider less vehicles, more public transport. How do you encourage walking, cycling, cleaner transport? With the sort of urban planning, if you can have more compact cities that are not so spread out and reliant on people bringing their cars, having to use their cars to get into the centre of city. I'm sure a lot of you have spent some portion of today sitting in traffic trying to get into offices. Urban planning, really, really key. Reducing, another way of reducing emissions and air pollution. Housing. How do you make sure houses are healthy, have correct ventilation, affordable construction, and then waste management, reduce, reuse, recycle. And I think we're going to have a lot on that later from Jemma as well, when she talks about waste. But here thinking about how to better manage waste to reduce air pollution, and particularly like this could be around the burning of waste and rubbish and the amount of pollution that creates within cities. With industry and any sector within the industrial sector, thinking about clean technologies and really pushing for that. And then, of course, the healthcare sector is important. So part of that role is about clinical care, but it's also about pushing for and leading this multi-sectoral response. And I think I know from some work in with the partners in Ghana, and looking at how you might try to do that within a city, a local government within the city, a district authority. How do you actually work with all those other sectors to try and address some of those issues? Do you even have a budget for that? Do the staff sitting at the district level have the skills to be able to do that? These are all the kind of questions of how do you actually operationalize something like health in all policies? So lots of questions there, good questions to think about in our Chorus projects. And I think they might come up in some of the Innovation Fund projects that have been submitted as well. So I'm really hoping we can take some of this work forward. But before I do that, I want to just welcome our two speakers. So as I said, we have Prof. Charles Hongoro is also on our CAG, and then we have Jemma Phillips, who has very kindly agreed to step in for Prof. Barbara Evans, who's one of our kind of specialist advisors for Chorus, and Jemma has worked with Barbara on the work around water and sanitation. So very happy that they've both managed to join us today. And if I can ask you to, as you're hearing their presentations, please do put any questions in the chat. They're going to present for about 20 minutes, and then we'll have 10 minutes for discussion on the issues that they raised and how they might relate to you. And then at the end, we'll have 20 minutes just where we as a Chorus team, with the inputs and support from Jemma and Charles, can think through some of the facilitators and challenges to multi-sectoral working within the cities where you're working for Chorus. So if I can hand over, first of all, to Charles, and for your presentation, hopefully. There we go, brilliant. That's great, Charles. We can see your screen absolutely fine. It's not in presentation mode yet, but that may be coming. Yeah, well.
Okay. Can you see it? Hello?
Yes, we can.
Oh, you can. Okay. All right. Thank you very much, Helen, and thanks for that introduction. I thought I could just share with you some experiences and maybe some projects that speak to some of the critical pillars for Chorus. And I structured it in such a way that it's a very conversational presentation, and so I hope it will not disappoint many. But I'm hoping that as I present, you will be able to pick up things that might be relevant or you might want to pursue in your own work. And I'm also glad that when I was introduced, this is the space where a lot of people sometimes become uncomfortable as a health economist or as a public health specialist. But I think it is a very important area in us understanding the dynamics of urban health systems and urban health populations. So what I thought I could do is just maybe give you a brief description of what we do, where I am. I won't take much time there, but then maybe pick 2 examples of projects that we have been or have been involved in, and try and see to what extent what we found and what we recommend speaks to the broader agenda of Chorus as it relates to issues of multi-sectoral responses, the issues of the plurality of providers, community empowerment and response. And then, of course, I'll just end with some concluding remarks. There are a few other projects that I had lined up, but I thought that I would, do better by just sharing with you maybe just 2 projects. And if time permits, I can then speak to this project on analysis of non-communicable disease prevention policies, where the idea was how do you apply the multi-sectoral approach in both formulation and development. And then if I get time, I can also speak now to some of the actual concrete responses in terms of smart agriculture, and of course the projects around the energy, water, and waste nexus. This is, I hope it's visible to you and you can see, you don't have to see everything, but I just wanted to let you know that I work for the Human Sciences Research Council, and it's a big organization and it has many divisions. As you can see, there are research divisions, inclusive economic development. Then there's the human and social capabilities division. And then there's a developmental, capable, and ethical states. So this is the division that I am the acting divisional executive, but I'm also the strategic lead for the subdivision that is called Peace and Sustainable Security. And in there, we also have a division called Democracy, Governance, and Citizenship. And we have a BRICS Research Center that looks at some of the cross-cutting research that's done in the BRICS. Just to flash and say that these are our broad objectives as the developmental, capable, and ethical state. So we try and focus on producing knowledge that improves the capacity of the state, and also any knowledge that speaks to peaceful and secure and sustainable democracies, particularly more resilient communities. How can you build resilient communities? And of course, like everybody else, we want to be a trusted partner. And as I said, our focal area in DCAS are peace and sustainable security and democracy, governance, and citizenship. But I thought this graph might just help you put you in the picture in terms of our thinking of how we approach the issues of human security. We do quite a lot of work that speaks to these notions of human security, economic security, food security, health security, environmental security, personal security, and political security. As you know, this is a whole notion that evolved from the human development literature that begins to say you need to look at people's vulnerabilities and look at how do we respond to people's vulnerabilities in different areas, and to the extent possible, look at it from a holistic point of view. So if you like, applying focusing on the multidimensional aspects of human life. And why then do we focus on these vulnerable and urban populations? And I think this is something, it's nothing new, and I think we all agree that there is quite significant portions in cities and towns of poor people. Poverty is a big problem. Inequality is even worse for countries like South Africa, where we have the highest Gini coefficient in the world. Unemployment is rife, reaching almost 40% of the youth population, and that is huge. So it becomes quite important that by looking at the urban populations, you are also looking at the vulnerable groups. And the other is, of course, the rural-urban migration. I think this is a phenomenon that we see in most countries. in low and middle income countries where communities from the rural areas go to the urban areas. And when they are in the urban areas, there are so many challenges that arise. So the question is, how do we deal with this urban population, particularly the vulnerable ones? And I think, as been mentioned, the challenge then becomes, do we have local governments that have the capacity to respond to these social challenges in the urban populations? Do they have the resources to be able to respond adequately to these challenges? And of course, this is the reason why, for us, focusing on urban population becomes important if we want to address human development within cities. So I thought I could start by giving just one example of a study we did, be dated, but I don't think it is dated. It's a huge data set that a colleague of mine and a whole team we generated. This is work that emanated from human settlement, where they were saying we do have what we are calling informal settlements, are obviously slums in the cities. We see this as a very big phenomenon in South Africa. When big communities move to cities, they tend to stay in these informal settlements that are either close to town, but these informal settlements tend to be located in open spaces, spaces that don't have basic infrastructure. So the question was, how can we address the issue of informal settlement through upgrading? This is the question that we were asked by that department. And of course, we were asked to do a national study. So we had to look at the entire country, look at the population of informal settlements, and select them using all sorts of methods, statistical methods, to make sure that we have representative sample, because we have, in South Africa, we even also have informal settlements in rural areas. There are few, but they're there. So the question was then, how do we go about doing this? I'm not expecting you to see everything that is in this slide. What I just thought I needed to show is that within the thinking that we had, or we discussed with the Department of Human Settlement, was the question of health and safety. So the idea was to look at how, if we are to upgrade these settlements, what kind of basic infrastructure do you need? What kinds of roads, what kind of drainage systems, what kind of amenities are we talking about? Related to that also were other issues that have to do with land, because they tend to be located in places that are government or municipal land. But I think more importantly, which is something that I think for Chorus becomes very important, is the issue of empowerment of communities. Because if you're going to have community responses, responsive solutions, then you need to empower them. So we went about, developed a module that was meant to look at different aspects of informal settlement. So although I'm not going to present all of them. So we looked at the issues of access to basic services, the physical environment, which meant the type of buildings, the places, the type of land where they're located, the levels of pollution, whether they're close to highways, etc. Then we also looked at health in terms of facilities, in terms of general disease patterns, burden of disease. We then looked at food and nutrition, access to food, and also the types of food that they eat. Then we ran another module which looked at crime and safety, because again, this has to do with questions of violence, even in the households and outside. And then we also looked at economic activities. And I think one that is quite interesting when you're looking at these vulnerable populations that we looked at was the whole question of social capital. What kind of structures do they have to respond to some of their challenges there? You know, we know all sorts of things like burial societies that exist in there, even though they're a dynamic population. But then we also looked at another aspect which spoke to the social integration and the attitudes towards foreigners, because, you know, in South Africa at that time, we also had challenges of social integration and xenophobia. So there is a whole wealth of data that we then collected. And I thought I could just share simple, one or two results that demonstrate the magnitude of problems, particularly in these kinds of communities. Access to water. Just one thing that I would want to show is that these are the provinces of South Africa. Gauteng is where, Johannesburg is. So if you can see my case, I just want to show you one measure of just looking at households, source of drinking water. So you can either drink, you can have the source in the dwelling, means in the house, or at the site, which means on the yard, because you can have more dwellings per yard, or you have a public or communal tap, or you have a water carrier, or you have a river. So this is the other sources. But what I just wanted to show you is that when you look at these informal settlements, particularly in Gauteng, look at this, more than 50% of them were using a public or communal tap. And just that signifies a lot of challenges that have public health implications and also have crime and safety issues. And that have a lot to do with sanitation as well. So we really found quite some statistics that were really, well, they were confirming what we know in some way, but the magnitude was just huge. And I'm just picking, for example, if you look at sanitation here, again, in Gauteng, the number of people sharing a toilet, this is almost horrific to think about 57 people sharing a toilet. And this phenomenon cut across the provinces. And then we were asking also issues of energy. Of course, when we were asking about this, it had to do with energy for lights, energy for cooking, energy for heating, etc., etc. But here I just thought, no, let me show you how much these communities tend to rely on other sort of traditional, if you like, forms of energy, like paraffin, and gas. Some still have electricity, which was for 41%. But this electricity, another thing to say, is not electricity that is properly done. This is electricity that is illegally connected. So when you go into these communities, I can assure you, you will be stepping on wires and everything that you can think of as they try to get electricity. So the situation in terms of energy supply and access is bad in informal settlements. Just this one, to look at the aspect of food, we had to ask them questions around, has the family, is it worried about running out of food? Is it eating healthy foods? Again, you will see in all the metrics that they all fall on the bad side, that, we had quite a significant number who always responded. They always or sometimes have challenges with accessing or running out of food or sleeping without having food. And then I just picked one on crime and safety. Crime and safety is a big issue in these informal settlements. They're quite huge, some of them. And everyone who lives there understands and therefore saw crime and safety as a big issue. Very few people thought that this was not an issue, but it is an issue if you look at how these settlements are organized. So just some key issues that I thought maybe I could say around this. This is work that had to feed into some existing program of upgrading the informal settlements. And what was appealing was the fact that we're able to work with the Department of Human Settlement itself to share these results and to begin the planning process. In South Africa, at the district level, if you like, at the local level, there is what they call integrated development plans. These are plans where the different sector ministries are identified and the specific purpose or role also identified. And a significant part of the development of the IDPs is the community involvement. Well, that's what it is supposed to be. But we felt that by painting the picture of what the situation is like in informal settlements, we were able to feed reasonably good information into the IDPs. The other point I want to raise is that after this work with doctoral students who is now working on how do we make sure that we can deal with the question of energy, water, and waste, not waste in these informal settlements. The idea here is that we have an engineering company that has got a technology that's looking at how to use waste to generate energy, and then to use that energy to try and recycle some of the water. So part of the work is not just technical, but it is also qualitative in the sense of trying to find the appetite of these communities to recycle the water. So that's quite an interesting project that is ongoing. But the third point to make is that the social capital exists even in these dynamic communities. That I think if you are looking at having community responsive, you can seize on or capitalize on. But one issue that came out in the last couple of months, we had floods in South Africa, particularly in Durban, in KZN, which began to demonstrate the vulnerabilities of these communities to floods. And we do have some work that we do. We have a team that looks at disaster risk reduction. And that team had actually before the floods had done some study to model the vulnerability of those areas and to actually indicate what needs to be done. But you know, communities are complex and it's very easy for them. It's not easy for them to listen to these kinds of risks or to appreciate those risks that, no, look, you are in the flood plains, you need to move out, but these are the poorest of the poor. So there's not pretty much you can do to change their attitudes. It's not easy. Now, so the second example that Helen, you can tell me how much I'm doing in terms of time because I like to talk to myself. The other
Charles, you've probably got about another 2 minutes left if you could just, this one sounds really interesting, but yeah, 2 minutes.
Okay,
thanks.
So let me just quickly go through this one. The reason again for this one is that we are working on a national survey on food and nutrition. But the reason why I'm mentioning it is that it also focuses on urban settings and also begins to show and quantify some of the food insecurities that we see in South Africa. And one of the provinces again that is included is Gauteng. And I just picked out Gauteng, or city where the city of Joburg and other cities are, just to demonstrate again that when you look at urban populations in terms of their access, food security situation, and we were using a number of scales, particularly for measuring food security. We had the household food insecurity access scale, the household hunger scale, the dietary diversity score, and food consumption. We started to see that rather than just looking at the aggregates, that even when you start breaking down the data on food insecurity, you can begin to see the discrepancies or the challenges. And you can see here just one example, which is the West Rand. This is data that is just coming out. I just asked my guys to just send me this. We're working on the reports. That we do have sections of the communities that have very high levels of food insecurity. And I know that when we start digging down for West Rand, for example, we'll begin to see that these are the areas where you have a biggest number of informal settlements. And all these indicators that have to do with when we were asking them whether they have had families having sleeping with no food, without eating, hunger, the levels again are also very high. And similarly, as it looks at diversity score, again, you would expect it to be much low. I mean, this figure should be much higher than what it is. And similarly with the food consumption. And this is just a map of Gauteng. This is the place that I'm talking about. And you can see on the West Rand here, this is where food insecurity is quite a big issue, but we would drill it down to go down to the actual communities. So again, an example of just showing the food consumption score and how does it spread across these countries. This is the similarly now for nutrition, that you have very high levels, and you can see, I'm just picking that one district, that you can have, high levels of stunting in that particular district, which is the West Rand. And even when you also look at underweight, and of course, the other indicators will show, but we'll see, you can also see that amongst its adults, we have quite an obese and obese adult population, which predisposes people to many risks. So food insecurity is a big issue. The diets are not good. Nutrition challenges still remain amongst the under fives and the adults. And of course, you need to interventions to improve food access and to promote local food production in urban areas. Now, maybe just at this point, this is where now we have now started, we just got commissioned to start looking at smart agriculture in the city of Joburg. So the idea is to do a feasibility assessment, particularly looking at the different technologies that are already being applied. And we have then been asked to do an options analysis to then say what would be best for the different types of communities. As you know, in cities, I guess we are talking about now the deprived areas. Nobody in Sandton here would want to be interested in this. So we are looking at a whole range of rooftop technology, aquaponics, different types that we're just going to model and then do an investment and economic analysis for the city of Joburg. So I won't say much about this because that's what I was referring to in terms of where the interest was really on multi-sectoral application, and we're looking at the barriers and of course the facilitating factors for multi-sectoral action. But maybe just to say that I think public and stakeholder participation, well, first you have to identify them, and second you have to create platforms for engaging them. So we found that as an enabler. And of course, the political will. This is the usual mantra we always say, but indeed, in this case, it is quite necessary. So my general remarks are that really challenges facing urban populations are multidimensional and they are complex and sometimes require multiple legal entities or authorities to addressing them. That's why in the context of South Africa, at a local level, you have local government, then you have district municipalities, and then you go up provincial and then national. So the idea of cooperative governance provides the legal framework within which multi-sectoral response works. But more recently, in the last year or so, there's been now this idea of a district development model. This is where, by law, departments are forced to work together, to plan together. So there is a legal framework to actually force multi-sectoral collaboration. And just that looking at the stats that I was sharing there at an aggregate level doesn't help. We really need to scale it down to the lowest level so that you can begin to see disaggregated results. And then so that, again, you can develop targeted interventions. And I think part of that is the active empowerment of the urban populations, especially if you want to have sustainable livelihood change, et cetera, et cetera. Sorry, Helen, that's what I thought I would have, but I hope just by sharing that, it might have sparked some ideas around what areas to look at, where we can collaborate, or where you might need more information and questions. I'm happy to answer. Thank you.
Thank you so much, Charles. And I think your data was just great at bringing out all those, the wide impact from crime to all the social issues, as well as the water and sanitation and the more sort of physical, environmental issues and nutrition. That it just really brings it to life, and why we need this kind of multi-sectoral action. And really interesting to hear about the attempts in South Africa to make that happen at district level. So yeah, thank you. Really thought-provoking, incredibly relevant to everything we're doing in Chorus. So yeah, I'd like to hand over to all our participants. Anything you'd want to share, or any thoughts triggered by Charles's presentation, please do. If you could just raise your hand, and then we can bring you in. Okay, so we've got a question from Tim in the chat. Does the district development model actually work in practice? It might be law, but does it lead to good cooperation and interventions? It's a good one, Charles. I don't know if you've had long enough to work out, whether it's been in place long enough to work out the effects, but yeah.
Yeah, no, I think the first question is that we were actually tasked, my team, to do a pilot in one of the provinces to look at its implementation levels and the extent to which it's working. I think the easy answer would be to say, we're still looking at it and see how it will work. But what I can tell you from the preliminary findings is that because now it is a legal requirement, departments or sector ministries are, in a sense, forced to work together. But what we still want to see is whether the structures that have been established will become sustainable, because it's all about leadership. We have a ministry called COGTA, Cooperative Governance. They're the ones who have been coordinating this. So there's still a buzz, and maybe I would say it's too early. When you start a new thing, people are interested, they participate. But the question is for how long they will sustain this. So as a research institution, we've been asked to develop an M&E framework so that we can monitor the implementation, but also the performance of the district's development model. The early signs are that there is potential, but I hope we're not going to fall in the same pathway that most countries do. You start, there's excitement, and then it wanes away. But that is a very good question that we are always asking ourselves. So if we talk again in a year's time, I might have some much more concrete things to share.
Thank you, Charles. Any questions from any of the other participants? Okay, Charles, do you have insights on how to get potentially competing departments to cooperate with one another effectively? Really challenging, particularly when budgets are tight within local governments. Yeah, how do you make that happen?
Yeah, I think trying to make departments work together. This is why, from my own other work that looked at the performance of different government clusters. So you would have different ministries that are called a cluster for economics, or a cluster for social development, or a cluster for this and that. I think it always boils down to the leadership, who is driving that cluster and who is using evidence to convince the others about the benefits. Because this is why in my slide I was saying government departments themselves compete. So where you have competition, even intersectoral competition, how then do we achieve multi-sectoral cooperation when we bring in the private sector? So trying to build alignment of objectives across government is always a challenge. But if you have leading ministries like Treasury or COGTA, in this case, that's responsible for intergovernmental coordination, it does help. Sometimes it also helps. For example, this district development model has the support of the president. So the higher the political authority that is behind an initiative, the greater the chance that the sector ministries will cooperate.
That's really interesting. And I was right, do you have a system of mayors in South Africa? I'm just wondering, because I know like in Bangladesh, they're quite sort of influential, and a potential again are a sort of can play that role of leadership on these kind of issues. But yeah, do you have something like that in South Africa? Or
what did you call it? Mayors?
Mayors, yeah, city mayors.
Oh, city mayors. Oh, okay. You see.
Sorry. My accent.
No, yes, absolutely. We do have executive mayors in cities.
Okay.
Again, this is where the complexity comes in as well. Where you have local government led by a mayor, then you have provincial government that is also operating that city and a district municipality. Where you have a strong mayor who is understand, then you have, because they are the ones who are supposed really to work with the communities. It works very well. We do have a province here, the Western Cape, if you know where Cape Town is. That's a very good example where the idea of executive mayorship can actually help coordinate government, particularly government departments, particularly at a local level, for a public purpose. So it sometimes works. But in other municipalities where you have capacity is a big issue. Capacity both in terms of skills and then capacity also in terms of resources. But in some cases here, it's really skills. It's just having square pegs in round holes, if I may use that expression. People that are completely inappropriate for all sorts of reasons because of how the political system works.
Thanks, Charles. And I can see Nazneen has got a question in there about whether your team are working to build capacity of different government departments or other stakeholders to respond to these social challenges. So really about capacity building within government departments.
Yes, absolutely. We are quite a big team. There's more than 40 of us in just one division. We recently have been commissioned to look at one of the cities, which is city of Tshwane. That's where Pretoria is, the capital. We have been asked to do a skills audit of the municipality there, and skilled audit against what they are expected to do. So in all sectors, so the team is really working on that. We have done it for other municipalities as well, where they acknowledge that what kinds of skills we need in, let's say, human settlement, in health, in I don't know, in enterprise or in the economic cluster and so on. So we have a project where we do skill audits, and these are very critical, particularly if you want to see how the capacity to respond to community needs. But it's a challenge, particularly for rural councils or municipalities.
That's actually, Charles, that's really interesting for us in Chorus, because as you know, we've got this big stream on capacity strengthening, and part of that is to work with local governments and different stakeholders. So it'd be really interesting to talk a bit more about that skills audit and how that works and the sort of skills that they identify as needed. I think it would be great for a bit of, maybe that's something for a future discussion within Chorus, because I think that'd be really, really helpful to hear the kind of things that are coming up. But I do want to move on, or else we're going to run out of time to hear from Jemma. So thank you so much, Charles. I think that was really raised so many issues for us within Chorus. So thank you for that.
Okay,
and yeah, Jemma, if I can hand over to you now, and yeah, hopefully you can share your screen all right and everything.
Yeah, super. I'll just do that now. Oh. Okay, so
Great,
can you see everyone saying Chorus webinar? Oh, sorry. Right, hello everybody. Thank you so much for having me. My name is Jemma Phillips and I'm a researcher at the University of Leeds on urban sanitation. And I've worked with, well, I did my master's under Professor Barbara Evans 6 years ago now, and I've worked with her ever since. So hopefully I can fill her shoes and share with you some of the work we've been doing and answer your questions. Okay, so the problem is that humans do poos. So there's a lot of feces, particularly in the urban environment, that's in a small concentrated area. And somebody calculated that there's about 4.6 billion kilograms of feces produced globally per year from humans. The problem with that is that feces can contain up to 10 million viral particles, 100,000 bacteria particles, 1,000 parasite cysts, and 100 parasite eggs in every gram. So I think because you're health people, you will consider source, pathway and exposures quite a normal framing for your work, but that's something I'm using in my work, which is not always used from an engineering perspective. So if you look at the top of this screen, you can see the sanitation chain, which is what is supposed to happen to the feces. It's supposed to go into the toilet, it's supposed to go along the sanitation chain and end up in the environment, but having been treated in such a way that it's safely managed and it's clean and it's not making anyone ill. However, going downwards, you can see the sanitation chain has various failure points, and we're going to discuss that as we go along through this presentation. This is the source of the pathogens, which are then in the environment either directly leading to exposure, or they might go through a journey before they lead to exposure. However, as I'm sure you know, even if the pathogens are in the environment, if they're not causing exposure to humans, there might be a huge amount of bacteria or viruses in a certain part of the environment, but if people are not being exposed to that, then actually it's not causing disease transmission. As Charles rightly mentioned, that nutrients is really important for children in order to enable them to grow properly physically and also cognitively. So a lack of nutrition can also cause reduced IQ and reduced educational attainment. But a key thing with this is poor water and sanitation, because as you can see going around this wheel here, that a lack of nutrients causes a weakened immune system. But even in children who have sufficient nutrients, the continual infectious disease from diarrhea or worms and helminths can actually cause nutrient losses from the body, which can actually end up with stunted children even where there's sufficient nutrients. And one of the reasons for this in this bottom image you can see is it actually causes changes to the gut. So from a normal gut that has a lot of waves that can absorb all the nutrients from the food, the inflamed gut actually is smoother walled and doesn't have as high a surface area to absorb the nutrients. So actually you can have children with stunted growth who have sufficient nutrition because of the high level of enteric disease that they are facing. So as I mentioned, there's this concept called a sanitation chain, and it's been typified as this from containment, which is the toilet system, through emptying and transport to treatment, which is sort of very nice and clean as a chain, isn't it? From the toilet to the treatment to the disposal of the feces. So, for example, for me in the UK, this is how it works. I go to the toilet, and then the sewer network of pipes and pumping stations takes that waste to the treatment plant. And in the UK, it's mostly treated to secondary level, and then it's disposed of in the rivers and seas around the UK. However, many other countries have a high prevalence of on-site sanitation, which is something a bit more like this. So there's the toilet, and then there's the containment on-site. So there's something, a pit or a tank that holds the feces on-site, usually on the person's plot of land. And then there needs to be some kind of emptying, transport, treatment. However, this looks all very neat and sort of very official, but in reality, it's a bit more like this. There's some kind of latrine, pit or septic tank, and it could be a nice vacuum truck leading to a treatment plant, or it could be emptying by different methods, like by a bucket and a spade and somebody stepping into the pit or the tank. The transfer could be on a bicycle truck or anything, you know, a hand-wheeled cart, or often the pit latrines are just buried over when they're full and left in situ. And that's an excellent situation in rural areas when there's enough space to then just leave that pit covered, maybe plant some trees on top of it and build another pit. But in urban areas, the reliance on pits for the sanitation solution is something that doesn't really work because there isn't space to just leave that waste safely buried. And therefore, we have to then look at these emptying technologies, which become more challenging. So, as you can see, even though we refer to it as the sanitation chain, I more think of it as sanitation chains, because there's so many sort of journeys that the feces can go along within the chain, and also therefore many points where failure can occur, and those failures are what lead to the transmission of disease within the urban environment. So in our work, when we talk to sort of environmental engineers and policymakers and decision makers for sanitation, usually we come saying, right, we need to talk about the sanitation in your city. You know, there's a lot of childhood mortality or health issues or stunting or diarrheal disease. And the engineers are all thinking about this. They're thinking about the water plumbed toilets. They're thinking about a situation with infrastructure like good open road networks, electricity supply, and then a big overly engineered sanitation works, as you can see there. But as I said, the reality is often more like this. Hanging toilets over a river, people having to dig out pits by hand with a bucket and spade, or toilets directly discharging to some open drain networks, and people using rivers for their toilet and bathing needs that are highly contaminated. So what is safely managed sanitation? So you can see this is a highly engineered version, and this is obviously a not very engineered version, but is that necessarily the key thing about what's safe or what's not safe? Not necessarily. So what is safely managed sanitation? That is a system which separates and keeps separated humans from their excreta, from their feces. So I'm sure you're all familiar with the Millennium Development Goals. So that created this thing called the sanitation ladder, which looked at how we can move people to better and better services. So it started with looking at open defecation, which is people who have no toilets whatsoever and defecate maybe in a bush, maybe behind a building, maybe directly into a river, and looked at moving them towards from unimproved services to limited services, to the top of that scale being basic services, which was a toilet on site that's only shared with one household. So countries such as South Africa took this on board and did massive investments into making sure that their citizens had basic sanitation, and India is another example of this. You know, this massive drive to make sure that every household has a toilet, and there wasn't as much consideration as to what the sort of underground aspect of that toilet was, but just that the toilet visibly had a slab, it was cleanable, it had privacy, and all these things that are in the MDG's definition of basic sanitation, which is excellent. There's no denying that improves safety, it improves dignity. There's loads of excellent things about that. But to go back to this, does it, yes, it might separate the person from their feces at that moment, but does it keep separated humans from their excreta throughout the whole of that chain? So then come the Sustainable Development Goals from 2015, where the idea of safely managed was introduced. So I'll just go on to this, a bit of a busy slide here, but I've highlighted the global indicator of 6.2.1, which is for the population to be using safely managed sanitation services. So, as I said, this is a system which separates and keeps separated humans from their excreta. That means that basic sanitation is no longer enough, and that's finally been recognised, which is excellent. That's something that Professor Barbara Evans was really key in pushing for, because just to give someone a toilet actually is not enough at all. And actually latrines cannot be maintained if they cannot be emptied. So once the pit or the tank is full, there's no longer a sanitation service there. And if latrines are just built without particular consideration, particularly if it's built in such a way that, okay, problem solved for the next 5 years or the next 2 years, it's kind of just kicking the problem down the road into the future. Okay, we've spent this money, we've done this investment, this community, each household has a toilet, fantastic. But what happens when those pits are full and therefore poor emptying practices or a lack of emptying practices can just result in it not being safely managed. Yes, they have basic sanitation, they have toilets. The toilets might look really nice, they might be flush toilets, you know, they might have nice tiles, but they're not safely managed if what happens to the feces after that containment is not safe for themselves and for their community. So there was some reviews done over the last few years about the health benefits of sanitation. And so there was the MAPSAN study in Maputo, there was WASH benefits, and there was the SHINE study in Bangladesh. And those studies looked at the health benefits of massive sanitation and nutrition interventions. And sadly, they found that in settings where contamination are pervasive and burden of infection high, even considerable reductions in contamination and exposure may have been insufficient to realise measurable health gains, as the intervention did not address all potential transmission pathways. So this might be more obvious to you as health professionals. So, you know, considering, for example, if we were talking about COVID, if we suddenly all start washing our hands, we might have blocked that potential transmission route, but everyone's still sneezing in each other's faces with no mask wearing. It's a bit similar to that. You give people a toilet and you've maybe prevented one aspect of the transmission, but all of the other aspects of the transmission are still ongoing with no particular mitigation. So there's a way of looking at this called the F diagram, which a lot of you might have seen before, which shows that the feces of one person becomes, of course, the vector for transmission to the next person, and it can travel along pathways of fluids, so water, fields and floors, flies, and fingers and foods. And theoretically, the toilet barrier, the safe water barrier, and the hand washing hygiene barrier should be enough to block all of these pathogens, but actually it needs to be a safely managed toilet barrier. So for example, even if you're in a rural area and the feces is all going to a pit and it's going to be covered over, but if it's leaching into the groundwater and there's a well nearby that's becoming infected with fecal pathogens, then you suddenly have a pathway that fecal pathogens can infect the next person. So there's a lot to consider within this diagram. Even though this was made about 60, 70 years ago, it's still, I think, just such an amazing diagram to consider all the pathways and all the ways that the different F elements interact with each other as well. And my personal research is about this and about the way that fecal pathogens are moving around in cities, and particularly affecting communities that do have sanitation and safe water supply, and the other ways that the pathogens can affect those communities. So as I was saying, this is the sanitation chain as it should be, but the failure points in the sanitation chain are allowing feces to be in the environment, and then that leads to human behaviour interacting with those exposure points to mean that people are having high levels of infection. And I haven't actually included it in these slides, but there's a way of testing that called the SaniPath methodology, which samples exposure points in the community, such as the water, the wastewater, the drain water, any surface water, flood water, soil, fresh food, street food, bathing water, and anything else that you think might be a relevant transmission pathway, and you put it all together, and then you ask people how they're interacting with those exposure points, and that gives a really interesting outcome showing what the key exposure points are. And actually in 80% of the data sets on the SaniPath website, fresh food, fresh produce is actually one of the key exposure points. And so that's also informing my research in that aspect. So, sorry, where am I up to?
Jemma, you've got about 2 minutes left.
Okay, right, so I'll just get straight on to talk about the excreta flow diagrams, because that was one of the key projects that we worked on. So this was invented by Professor Barbara Evans and Andy Peel and a team with them about 7 or 8 years ago. And now there's about 250 data sets on their web portal, which is really cool. But this is an aggregate of about 30 or 40 cities. I just want to talk you through this so you can start to understand and imagine the way that sanitation systems can fail and therefore lead to health impacts. So number one, of course, is open defecation, where people don't have access to a toilet or choose not to use a toilet. So of course on this, oh, sorry, I should start by showing you. The green flows are the safe sanitation. So the top one is off-site sanitation. So it's wastewater contained and delivered to treatment is the big green stripe going across the top. And then for the on-site sanitation, we've got the fecal sludge contained and the fecal sludge contained and not emptied as a green streak, which means it's a pit that's safely closed, or contained and emptied and then delivered to treatment and treated is the next green stripe across there. So that's showing the percentage of people who have safely managed sanitation in this example. So yeah, going to the red flows, which are the unsafely managed flows, so open defecation. And then there's the flow that most sanitation infrastructure or investment or projects focuses on, which is the treatment works. I'm sure you've all seen in your context that there would be the World Bank or Bill and Melinda Gates Foundation or the government have done a big investment in sanitation. Oh, look what they've done. They've built this wastewater treatment plant, spent whatever X million US dollars on a wastewater treatment plant. However, if you look at this situation, the areas that are circled in yellow, for this conglomerate of 36 cities, I think it is, or 39 cities, that actually is quite a small percentage of the unsafely managed sanitation that is fixing. So that's 9% here of the unsafely managed sanitation would be fixed by building a sewage treatment works and a fecal sludge treatment works that would be, yeah, I mean, those billions of dollars that are spent every year on building sewage treatment works don't necessarily have any effect on the health of the city. And also often that fecal sludge and wastewater not treated is being discharged into river bodies and things like that that aren't necessarily used for drinking water, depending on the context. So yeah, so we've got not contained and not emptied are usually pit latrines or tanks that are leaking, overflowing. Obviously, you can see that that's going to be a very local impact and a big problem. Then you've got the fecal sludge and the supernatant, which is the liquid portion, not delivered to treatment. So that's a tricky one because that could end up almost anywhere within a city, depending on what happens. So some of it could be spilt directly. Some people dig a hole in the side of their pit when the flood water's coming, because the flood water will very kindly empty their pit for them and wash the sludge away. Or it might be dug out and dumped into the open drain, or it might be taken away. And then, yeah, wastewater not delivered to treatment from off-site sanitation, which is usually due to leaking sewer networks, which is a common issue, especially in infrastructure that's quite old and needs maintaining. So as you can see in this example, 32% of the unsafely managed sanitation is actually to do with problems with the transportation, problems with the pipes, problems with the trucks or tanks, or the people digging it out not either having access or willingness, or it costing them something to deliver to treatment. So this whole area is called fecal sludge management, and it's something that finally is getting more investment in cities for health and safety, but Still, often the investments are going to that 9% of building treatment plants, which is actually not really solving the problem in cities. And I think over the last 10 years, there has been a lot of investment, as I said, into the 17% there of the not contained and open defecation, of ensuring people do have latrines, they do have toilets. So in most contexts now, that is more common, that people will have a toilet. But yeah, it's what happens next. So that's the question. So if you ever want to build the SFD, the excretor flow diagram, this is the screen you'll be met with. So you'll click on all of the squares that are relevant for your context, and then it'll take you to a page where you can put in all the percentages that are relevant for your context. So you might be able to say, oh, right, okay, the sewage network deals with 25% of my city, so I'll put that in, and you just go through like that. And sometimes you don't know and you have to make good estimates, but it's still a really valuable thing to do for each city, just to get an idea of actually what are the problems and what would be the useful interventions to do. So that's how it helps us to think about reducing risk. So as we can see in this example for Kampala, Uganda, there was a big problem with people not having good latrines that were actually containing the wastewater and the fecal sludge. So that would be potentially where you would invest in this city from looking at the SFD. I don't have much time left really to talk about the circular economy, but it's just worth bearing in mind that feces and wastewater does contain a lot of valuable components. It contains water, so particularly in water scarce areas, it's worth thinking about how you can extract and clean that water. It also contains a lot of phosphorus and nitrogens that can be useful in agriculture. It also can produce methane gas for energy, and also can be burnt for energy. So sometimes I know I have colleagues who are working on this more intensively who kind of think solve two problems in one go, you know, collect all the sanitation and then also deal with agriculture, deal with energy shortages and water shortages. That would be the ideal solution, but yeah, it's a big technical challenge. So from a multi-sectoral perspective, in order to actually provide good sanitation, when you realise all the different failure points in the sanitation chain, you actually need everybody to be involved in solving this problem. So you need the utilities, you need governance, you need regulators and policymakers, you need the local municipalities and also the community members to be alerted to these problems. And that's one of the great things about the SFD diagrams, is with a little bit of explanation, non-technical people can really understand actually what's going on in their cities. Private businesses often need support to run the sludge management services, and NGOs and big donors, as I said, they need to really consider where they're putting their money, because often it's wasted and doesn't really improve the health of the communities. And then agriculture and health providers also need to know what's going on in their cities. So any questions? I'd love it if you turned your mics on and asked me things, but if you want to put things in the chat, that is also fine. And if people are watching this on video, my email address is on the slides, so you're welcome to email me as well.
Thank you so much, Jemma. That was really interesting, and I just loved your clear explanations. And I think from so within Chorus, we're always trying to take a very systems perspective and approach. So I think looking at the ship flow diagrams is just a great way of seeing how you need to take that systems approach. You can't just look at one bit of it. You've got to see how it all connects and then identify the kind of touch points and where you need to work. And I think I put the link to the paper that Jemma mentioned on the sort of lessons learned of using those diagrams. And I think what's really interesting, I remember being with some partners that we work with in Kenya at the African Population Health and Research Centre, and them just talking about the process of completing, so that spreadsheet that Jemma showed, and basically they had a workshop, pulled together people from the county governments in Nairobi, all different sectors, the private sector as well, who were involved in like each stage of that process, and putting them all together in a workshop to jointly complete those spreadsheets and to really discuss where they needed to target their attentions. And I think it's just a great example of when, you know, it's a way of bringing together different sectors for action. And actually really engaging in a problem like that from all those different perspectives can really help to trigger action. So a really powerful tool for working across different sectors. So yeah, thanks for sharing that, Jemma.
Yeah, and I can just add my thoughts actually to do with one of the questions that were asked to Charles, to do with getting the different groups to work together. I think there's some really good data to do with the health benefits of sanitation when it's actually working, as opposed to when it's wasted investment, and also the economic benefits for a city for having a healthier population, and also the economic benefits for a city of having a population who are better educated because they can go to school more and they can go to work more rather than being sick with helminths or diarrhea. And I think when you get everybody seeing that this task will meet goals for each of their targets, then people are more likely to work together.
That's a really good point. And I think some of the work that economists have been doing around looking at multi-sectoral benefits and using those to encourage policy change is incredibly relevant here. And yeah, I think that's a really good point. Any questions from anybody on the call? Please do just raise your hand or put something in the chat. Or maybe particularly consider kind of what, you know, I know everybody's been working on your needs assessments and really getting to know the city authorities and the kind of issues. Any reflections sort of based on that knowledge of trying to use these sort of approaches for multi-sectoral collaboration and action? That would be particularly interesting to hear. I think we have a few left from the Bangladesh team, and Dhaka is one of the places where there is a ship flow diagram. I think that was one of the first cities, wasn't it, where they actually worked through this. So I'm sure there are some good examples of using that with stakeholders here. So everyone's gone very quiet.
I'll just put the link on the chat as well for the data, because it's really cool being able to compare like a whole country of all the data sets that are there, or your city that you're working on, and just having a look at what's already been done there. So I'll just put that. Oh, I think we've got something.
There's a question in there from Tajri from Dhaka. Curious to know whether a resource-orientated sanitation can be feasible for urban population. What do you mean, Tajri? Can you just explain a bit? What do you mean by resource-orientated?
I think maybe it means
what does that mean?
Economy.
Right. You go for it, Jemma. If you just, or Tajri, if you could explain a little bit more about your question, maybe.
Yeah, so there's a lot of studies been done over the last few years about, can it actually be economically productive to get the resources from the feces, and yeah, and there's mixed results, to be honest, or there's results where it's worked really well in the context where the person first designed the study, and then when they've tried to transplant it into different cities, it's ended up not working as well for whatever reason. I'm particularly thinking of some studies where dried feces has been turned into sort of like fuel blocks for energy and for agriculture. And I think, to be honest, from my perspective, it's always going to be necessary for public investment, for governments to invest in sanitation. I don't think we're going to get to the point where it pays for itself, but I still think we can get to the point where we're solving these big global problems in a more sensible way, where we consider how we can also solve other problems. There's So often in cities, people are using, like, tankers will empty a bunch of septic tanks and then literally be paid a tenner by the farmer to dump that content straight onto his land, and that does have massive health risks. But when it's done properly, when the feces is dried and composted or treated to some extent, that pretty much, it can be done without health risk. But there's a big informal infrastructure there where people are doing it just because they know it's good for their land or they know it's helpful. And yeah, therefore there's not always the right health mitigation studies. So Tim said, have you or others done cost effectiveness studies on the different interventions possible in the context of SFD? Yeah, so there's a project going on at the moment called Cactus, which is costing of sanitation interventions. And there's also some research by a researcher called Freya Mills, who's kind of done something a bit similar. And Cactus is looking at the costing and also the climate impacts. And yeah, and then Freya Mills has looked at the way that some sanitation interventions just kind of push the problem downstream. So for example, you might improve the health of your community, but you reduce the health of the next community because it's all going into a network that's making their health worse. So yeah, there is work being done to do with the sort of what's the word I'm looking for? The compromises and the positives and the negatives.
Yeah, that's really interesting. Do you have any references to that? I think particularly the last example, which are basically economists would call externalities, would be really interesting to find out more about.
Okay, I'll find that. Hold on.
Yeah, and I think this is giving lots of food for thought for project 2s in chorus. So I appreciate that lots of chorus members haven't managed to make the webinar, but we'd make sure that we really share this recording, and I think it can really help to trigger our thinking on this. Any other questions from anybody? Okay, well, Jemma, listen, thank you very much. It's been hang on, there's something from Nazneen. So just a thought, in the urban context of Bangladesh, I think ensuring multi-sectoral coordination is really challenging given political dynamics, power relations of different sectoral departments and ministries. For this reason, bringing all the relevant stakeholders under one umbrella is a prerequisite for urban governance issues. Yeah, I really agree. And Nazneen, if there's any examples from the context in Bangladesh.
But yeah, Helen,
it would be great to hear them.
As you were saying, that the process of doing the SFD, you can do it kind of like by yourself in your room. You can just gather all the data and look at what that looks like. But if you're going to do it really properly, the idea is to get all the stakeholders together, have kind of the data you've found so far, and then to get everyone to talk about, but actually what's the reality on the ground? What do I see in my water utility work, and what do I see in my road infrastructure work, and kind of get everyone to think about actually what's the reality. And some of the SFDs on the portal, like, I know that they were done from a certain perspective and they're quite optimistic. Like some, things that I know are really aging infrastructure, and they've said, 90% of the waste in this sewage network is reaching treatment works. And I don't even think that percentage is true in the UK, so I don't think it's going to be true anywhere really. So when you kind of get to know a bit more about the engineering side, you can kind of hash it out a bit, but at the same time it's really still a really valuable process, as you're saying, to get everyone together and kind of let everyone have their say about their perspectives.
Thank you. And I think it would be really interesting if there were similar ways of addressing other issues, because I think that is the power of this approach, that you can engage so many people from different sectors and you can look at it in a real systems way. So whether there's other similar approaches around air pollution or other challenges within the urban context, I think is a really interesting thing to explore. So yeah, so I think
I've not seen anything else quite like that, to be honest.
Yeah, quite like it. No, exactly. And I was wondering, particularly around air pollution, you would have thought there would be ways to structure it. So yeah, lots of food for thought, I think, across Chorus and wider. So yeah, but listen, Jemma, thank you so much for all your inputs. Really, really fascinating and really interesting. And also, Charles, thanks again for your presentation and all the points for discussion. I think it's given us a lot to think about in Chorus. I think some of these ideas are really crucial within our project 2s and our innovation fund projects as well. So I think you've really helped to stimulate the debate and the thinking within Chorus. So thank you very much for that, and thank you for your time. We really appreciate it. Great presentations and lovely to see you both.
Thanks very much.
Thanks so much.
Thanks, everyone. Thanks, Charles. Okay, guys. See you soon then. Thanks.